Arizona's nursing shortage is expected to result in a deficit of nearly 30,000 registered nurses next year. How best to address the issue of recruiting and retaining nursing staff, especially with the rapidly aging population that will need increasing care? Well, to answer those questions, joining us now, Dr. Amber Kuhl from the Arizona College of Nursing. I feel like I need a nurse right now. My voice is starting to go here. But what is the latest as far as staffing? I mean, we had you on like a year ago. Mm-hmm. Predictions were dire.
Yeah.
Is it any better at all?
I can't say that it is. We're coming up on 2025, and when those numbers came out, the estimation was from 2022 up to 2025, and now hitting that calendar year and realizing that we're essentially in the same spot. And unfortunately, with the pandemic and the estimated retiring nurses,
yeah,
that's where we also have to consider what it looks like.
What's going on here? Why is this happening?
It's a culmination of a lot of factors. So we do have, we were anticipating 1 million nurses to retire by 2030. So the nursing staffing is getting older and moving out of the industry. And then you add that the pandemic took a huge hit, right? It took a huge hit on individuals in the nursing, healthcare, what nursing looked like. And honestly, we don't have enough programs to get nursing students through the program and into the profession quick enough.
So, and I would imagine burnout, you mentioned the COVID, I mean, that had to have been a factor.
Yes, absolutely. I think something that we talk a lot about now is a practice-ready nurse. And once upon a time, a practice-ready nurse meant skills, knowledge, acquisition of a clinical judgment. And now I think practice-ready means coping mechanisms, understanding the reality of nursing, understanding the toll it can take on yourself as a nurse.
I was going to ask about that. Is resilience part of the education of being a nurse? Was it, is it, should it be?
Was it? I would say not as important as we should have made it. Mm-hmm. Should it be? 100%. Is it now? I think that's where programs are moving. So I can speak for our program. We build in actual courses and into the curriculum the reality of nursing and self-care and coping mechanisms and understanding what it means to develop resilience, but also providing skills so that individuals can become resilient. And I think healthcare systems are working really diligently to focus more on mental health of their nursing staff and their other healthcare staff.
What is the reality of nursing?
The reality of nursing is that you get to be with someone on their best day and you get to be with someone on their worst day.
Yep.
And you can't give to those people on their worst days if you haven't taken care of yourself. So it's very difficult to be there in sad situations or difficult situations over and over again without building your own toolbox to protect and keep yourself healthy.
And that is becoming an increasing focus in nursing education?
I believe it is. I think after the pandemic, we saw what burnout meant and what it looked like in real life. And now we're able to transition our curriculum and our processes to help students understand before they get into the profession versus waiting until some tragic incident has happened.
When you talk about nursing shortages, is it in hospitals? Is it in clinics? Is it urban areas, rural areas?
Rural areas will always be hit the hardest, just simply based on the number of people that are in an area and who is qualified to be there. I think what we're seeing is across the industry in all areas. Something else to consider is registered nurse bedside care versus advanced practice nurses. So when we talk about nursing, we're talking about licensed vocational nurses, licensed practical nurses, registered nurses, and nurse practitioners. And so seeing individuals advance themselves in their professional career also takes away from the bedside nurse. And so there's kind of this snowball effect that occurs.
Is there also maybe a cyclical effect here? Is a rebound possible after hitting a low point?
I absolutely believe so. We have numerous qualified applications going into nursing programs all over the country. I want to say 2023, there were 65,000 qualified applications submitted to nursing programs. So can we build up the opportunity for those that want to be nurses to get into programs? Can we partner with hospital sites so that we can improve clinical experiences, so we can get individuals through the programs faster. I think that there is an opportunity here for academic programs and healthcare systems to work together to fix this nursing shortage.
I remember a while back, applications to nursing schools were down. Is that still going on?
Not that we are seeing.
Okay,
Yeah.
good. That's good
Yeah,
news.
it is.
And in rural areas, you mentioned rural areas in particular. I mean, you have to go a long way. If there's not enough nurses here and you got to go there,
Absolutely.
that just doesn't make any sense.
No, we have to figure out a way to bridge the public health gap, which we're seeing, and nursing programs are putting a big focus on community health and public health nursing, and I think that the intent is that we have to find ways to help those that are in underserved populations.
Arizona, obviously, nursing shortage happening across the country.
Yes.
Is it worse here than other areas?
Arizona does have one of the worst nursing shortages.
Why do you think that is?
I wish I knew the answer to that. I think that there are opportunities for travel. So a lot of individuals, Arizona has a lot of programs, so people come and get licensed here and then they're able to travel. I think that there are issues with the size of Arizona and where people are at in the rural versus the urban areas. I don't have the perfect answer for why we're getting hit the hardest, but right now Arizona is one of the leading states with nursing shortages.
With that in mind, last question.
Yes.
Are you optimistic?
I am optimistic. We have I see a lot of students that come into our program and they're excited and they want to give back to the community, and we are opening campuses everywhere with the intent of helping to bridge this gap. So I am very optimistic that we can impact this nursing shortage.
All right, very good. Dr. Amber Kuhl, Arizona College of Nursing. Good to see you again. Thanks for
Thank you so
joining
much.
us.